Imagine a world where you knew that you mattered and you belonged. The people cared about you because we were so darn good at listening to one another, no matter how different we are. That is what Sidewalk Talk is doing by putting listeners on sidewalks all over the world so that we can practice the art of connecting. Join me, founder and director Tracy Rubel, as I interview experts on the fine art of human connection and interview some of our volunteers who've been listening on the sidewalk and even some of the folks that we've listened to. And if you want to volunteer, consider joining us at sidewalk-talk.org. I'm so excited to have you all meet Dr. Narendra Thagunna. You know, he is really on a mission to elevate mental health in Nepal, and he has led Sidewalk Talk in his country. I love this conversation because I learned more about how he's running his Sidewalk Talk chapter. You know, he's not only a psychologist and a specialist in cross-cultural psychology, suicide prevention, and really invested in the development of research methods to study psychology by founding Psycdesk Foundation. Dr. Thagunna wants to make psychotherapy accessible to people in Nepal. And so one of the ways that Sidewalk Talk is helping him do that is that he trains many of his psychotherapy students. And he said to me, he said, gosh, we go sit out and we have to sit out for 4 hours now because we have queues of people lined up waiting to sit down and talk to our listeners. And we would like to have 4 more Sidewalk Talk chapters. And he says at the end of this interview, you'll hear him say, how do I do that? So what I also want you to remember is that it is Giving Tuesday. And Sidewalk Talk's mission and purpose is to create a more connected world, because with connection comes health of not only people, but also public policy, politics, and our planet. So we are looking for 100 people that are as equally invested in this work as I am, as Dr. Thagunna is, and some of the other city leaders that you've heard on the podcast over the last several weeks. We're looking for 100 investors that are willing to donate a monthly dollar amount to keep this work going and massively changing this culture of disconnection that leads to mental illness, planetary illness, political illness. We can change this, and we are, and I'm so excited for you to meet Dr. Narendra Singh Thagunna in Nepal. Dr. Narendra Thagunna,
Yes.
I'm curious, how did you get started in the field of psychology and why?
Okay. I am interested on psychology. There is one incident while I was studying in a class 10th. That time I have some conversation with one teacher. And he mentioned that I know the other psychology because I study psychology in a bachelor's and bachelor's level. So after that, I am little bit curious that how he know about me or other people's regarding studying a psychology. That's why I am little bit interested on this issue. And then after I joined intermediate or school level education on a psychology. And then while I joined a school certificate level course in psychology, then I am very much interested on this subject matter. And after that, I completed my graduate in major psychology, and then after postgraduate in major psychology. And in this way, I am interested on this issue.
So tell everyone where you're located, because you're in another part of the world than I am. And where are you practicing psychology now?
I am from Nepal. That is a South Asian country. That is landlocked country in between India and China. I am practicing psychology here, Kathmandu. That is the capital city of Nepal. I am working here for last 15 years.
And you also are part of a project. Tell us about Psycdesk. What is Psycdesk?
Psycdesk Foundation is a private organization, private company, which is working in the field of mental health, psychology, and we will provide a psychological testing service in Nepal or in Kathmandu, and we will provide modular trainings for corporate sectors regarding a mental health issue, and we will work with the School of Psychology Nepal on suicide prevention issue in Nepal, throughout Nepal, and it is also this is also based in Kathmandu, capital city of Nepal.
Mm-hmm. So I'm curious, mental health seems to be a topic, no matter if I talk with you, Dr. Thagunna, or Meng Zaim in Malaysia, or when I talk to Dr. Patricia in Sao Paulo, Brazil. It seems to be there's something global going on. Tell us a little bit about mental health in Nepal and what your country is focused on.
Yeah, we have if we are talking about our country's mental health issue regarding, we have also the means we have a little bit stigma and discrimination regarding a mental health issue, and people don't want to speak openly on these issues in our country. And even though we do not have the national levels research how many people are suffering from a mental health issue in Nepal, but if few studies which are available in conducted in Nepal, that shows that around every four individuals, out of four individuals, one is suffering from some sort of psychological problem, mental health problems like depression, anxiety, post-traumatic stress disorder, and other chronic mental health illnesses like schizophrenia, bipolar, and these things over here as well. But community people and individuals who are living in our country, only the city people have a more awareness about a mental health issue, especially all the mental health professionals are more focused on Kathmandu Valley, and the remote area of Nepal have a less mental health professionals and less mental health accessibility in Nepal. And we can say means if we are talking about mental health problems regarding our community level, we have a high suicide rate, means in worldwide, seventh highest suicide rate in Nepal. Database shows that. And in this way, due to that, that is happened due to depression, or we are not seeking mental health professionals help in our country. So we can say not good condition, in the sense of the due to a lack of mental health literacy awareness in our society. We are still in suffering from some sort of a psychological problems over here.
There's something about hearing, I guess I've always had this fantasy that Nepal is a place of ease and peace. You hear of so many meditators in Nepal. And so to hear that mental health is an issue in Nepal like it is everywhere, I feel sad. And then to hear that you're so motivated because there's this high suicide rate. It must be really hard in some ways for you, yeah?
Yeah.
And painful to see all that. I do have a question for you, because this podcast is going to air right in succession with several of our other city leaders. did you get involved? Why did Sidewalk Talk come into part of your activism? Because you're so active in your community,
Mm-hmm.
elevating awareness of stigma, destigmatizing.
Haha. Yeah.
How did you get involved with Sidewalk Talk, and what are you hoping it will do?
Yeah, but I like this concept because I already mentioned that in our community level there is a lot of mental health stigma, and due to that, community peoples are not willing to take mental health services in our community.
Mm-hmm.
And while I go through this sidewalk talk concept, while first time I talk with you, and after that I go through the this concept and how you are working over there, and then I realized that if I will contextualize this concept in our community,
Mm-hmm.
that will definitely help community people to aware, and they will easily share their feelings with uh, others. And comparatively, we people are more talkative than western societies people, because our community and our cultural values, norms and beliefs is that we have a sharing and caring culture. Even after that, nowadays in our community as well, we people have less time to talk about their own emotional feelings and those things. And then I am very much impressed with this concept that I am also thinking that something like where people wants to share their feelings only, not we are talking about that their mental health status and those things, where they want to share what they want to share. And
Mm-hmm.
I go through while I go through the your sidewalk talk concept, then I realized that okay, this is what I am looking for. This is what, and then it will work our community as well. And let's start. And then I will I talked with you, and then I decide that okay, I will do at least, because already I am doing a suicide prevention activity in our community. So
Mm-hmm.
I thought through sidewalk talk, we will be able to aware community people's to share their feelings, and that will definitely help them, means our community peoples, to reduce suicide prevention issue. And I thought that sidewalk talk is a directly helpful for suicide prevention in our community level, and
Mm-hmm.
I am using this model to prevent a suicide prevention issue here in Nepal, and that's why I am interested on this issue.
Yeah, I really love hearing how you took the concept and then what you'd said is, and then I had to contextualize it so that it fits within our culture here in
Mhm.
Kathmandu, Nepal,
Yeah.
and that you're really linking it to your own suicide prevention activism. What are
Mhm.
some of the things that are unique? I mean, you'd said, hey, we're already a pretty friendly, caring, talkative culture, but we don't make the time to share our
Mhm.
feelings. What are
Mhm.
some other things that contextually you had to consider as you
Mhm.
were doing sidewalk talk? I mean, do you listen in groups? Do you listen indoors? I'm just curious how it might be unique or different, so that we are better
Mhm.
listeners cross culturally, right?
Mhm. Yeah, because uh, I what is means there is not that much different, but what we will do sometimes, what happen, community people normally we will say, and in our sidewalk talks guidelines or models, we will have only the 10-minute talk, right?
Yep.
Yeah, but sometimes our community people, sometimes while we will sit in the roadside and the public places over here, and they are more interested what is going on. And sometimes if we say okay, you means if you have any sort of psychological discomforts, and if you want to share your feelings. You are welcome in our center. If we say sometimes, local community peoples, they are not trusting us. But while we will sit in front of that roadside and then or a public place, and we will listen them, that time they are more willing to share what is going on. They are more curious, and sometimes they will observe, minutely observe. Then after that, individuals are willing to talk with us. And sometimes what will happen in our context, because we people have a means a Western cultural community peoples have a direct access that of what is going on. They will talk about that issue. And in our cultural context, if we have to say anything, we have to talk a lot, a little bit. We take a more time, and after that we will able to share our feeling easily. And that's why sometimes we will increase that only the 10 to 15 minutes. I mean, so
Sure.
sometimes we will talk 15 to 20 minutes. That
Yeah.
that is somehow we modify that thing. And
Yeah.
that work very well. That after that they are easily means, while we will connect that, okay, you will if you have a this sort of issue, or if you want to share anything, and those counseling centers, mental health professionals, and those service centers also listen you carefully. So I think you have to visit those centers, we will say them, and then they will more trust us, and they will visit our means our not only our, but others, those mental health professionals. They are seeking a mental health professional, and sometimes we get more attention through the national media as well, media personnels. And sometimes they have also their own hustles, and those things means they are also wants to share their feelings, but they are not getting a appropriate approach. And they are not able to get appropriate places where to share their feelings. And they will also come our that sidewalk talk area, and they will share their feelings with us. And
Interesting. Interesting.
yeah,
So they don't have a place to go, so they'll actually come seek you out.
yeah,
That's really amazing. So let me just reflect what I'm hearing. It
yeah.
sounds like what you're saying is you're being visible in the community through Sidewalk Talk is
Mm-hmm.
creating a trust in you
Uh-huh.
as mental health providers. So
Yeah,
as people get more and more comfortable
yeah.
seeing you out there on the street, they're
Mm-hmm.
more likely to come into the clinic if something
Mm-hmm.
problematic comes up. Am I hearing that right?
Yeah, 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 yeah.
That's really amazing. And then you're extending, by the way, we all extend the time. None of us give you the
Yeah.
time. But you're really, it sounds like it's been important when somebody does come sit down,
Mm-hmm.
that for you all, letting them take as much time as they need so that they can
Mm-hmm.
feel like that trust gets developed.
Mm-hmm.
Yeah, I think that's really cool. And so how many people are in the clinic that you run? I mean, you're training students, correct?
Yeah. Mm-hmm. I mean, how many? How many?
How many students do you have, or how many therapists are you training right now?
Yeah, we have in every group, because I'm doing these means we will provide a psychosocial counseling trainings and different therapeutic workshops and models to the students. So in one group, one time we have around 10 to 15 participants in one group, means those students we have. And while we will go to the that sidewalk talk, we have around 5 to 6, 7 volunteers with us in that public place. And we will listen community people. And around normally you means we will do means normally 2 to 3 hours. And yeah, sometimes that was normally while we will see in front of the community, that public place, there around our average time is around 3.5 hours or around 4 hours we will sit in
Oh,
a
wow.
public place.
That's a long time.
Yeah.
That's a big effort. Wow.
Because we have a overwhelming that respondents, and they will want to, means they are in a queue, and then we are not willing to hurt them, means they want to share their feeling, but if we say we are not able to listen
Wait a
you
minute.
people.
Are you saying that
Yeah,
you have a line of people waiting for you?
yeah, means while we are in front of a sidewalk talk for a community level, that time they are in queue.
You have a queue.
Yeah.
Well, holy smokes. This is
Pardon?
that's amazing.
Yeah.
That's yeah. Am I understanding? You mean you have a people waiting to be heard?
Yeah.
Wow. That's really, so you have to listen for 4 hours because you have people waiting to be heard.
Yeah.
It's incredible. I am so excited by getting to finally speak with you more about how this project is going, because I mean, you do a lot of activism, not just with Sidewalk Talk. So it feels like a real privilege that
Mm-hmm.
you spend some time with us as well. And I'm
Mm-hmm.
so looking forward to learning more. Maybe one day I'll get to come out to Nepal. That's my dream. And
Definitely,
sit on a sidewalk with you.
yeah, we are happy to welcome you in our country, and yeah, definitely this is we are very peaceful other way, and you will enjoy a lot over here. Yeah,
Yeah.
definitely, I am also dreaming that one day I will be with you to listen a sidewalk talk.
Oh, that would be so great. I'm really wanting a big group of us together from all over the
And,
world. Wouldn't that be
yeah,
beautiful?
yeah.
Mm. So thank you for your time today. Is there anything else that feels important to that you want to say, Dr. Tanguna?
Yeah, yeah. I want to curious. Sometimes we have volunteers, because according to sidewalk talk or guideline, only means one centers run only the one place, or that is nearby the 1 or 2 kilometer periphery, right?
Are you asking a question or?
Yeah, means I want to, means yeah, I want to add, because most of the our volunteers from a different part of Nepal, and
Uh-huh.
sometimes they wants to do means that sidewalk talk in a different cities in
Ah,
Kathmandu, outside
okay.
Kathmandu. So is this okay? Because in of my
Yeah,
under
so
guidance, or yeah.
Dr. Tanguna, all that they do need to sign up as a city leader, but we have community grants now so that they can just sign up and then Sidewalk Talk, because last year we raised enough funds from our
Mm-hmm.
fundraiser, which is why I'm having
Mm-hmm.
you on. So it's a perfect question. And for folks that are
Mm-hmm.
listening, this is exactly how it goes. Did you hear what
Mm-hmm.
Dr. Tanguna said? We would like to spread this around Nepal.
Mm-hmm.
For those that want to become city leaders, they usually have to fundraise a little bit of money, except for
Mm-hmm.
in diverse, underserved communities around the world, we fundraised to
Mm-hmm.
supply you with the supplies that you need. So the
Mm-hmm.
only thing they do need to do is they need to sign up and take the training, right?
Oh, okay.
And then it's I can send you the link, and for those of that are listening, it's called a community grant on our
Mm-hmm.
city leaders page. So we would love to
Oh,
have them.
oh,
How
okay.
exciting would that be?
Thank you. Thank you. Thank you. Nice
That
to
would be
talk with
so.
you. And we are willing to welcome you in Kathmandu or in Nepal in 2020.
Thank you so much for all your work in the community.
Okay.
Be
Okay. Thank
well.
you. Thank you. Thank you very much for providing me the opportunity and giving me the opportunity to talk about to lead this project in Nepal. And I hope I will try my best to contribute from my side along with our team. Thank you for this opportunity once again.
It's lovely to be in community with you. Really. All right. Be
Okay.
well.
Okay. Thank you.
Thank you for being here and listening to this episode of the Sidewalk Talk podcast. If you like what you heard, tell your friends, tell your family, like and comment on the podcast publisher that you're listening from, and subscribe. This will help us get the word out about changing our culture to one of connection.